Hello everyone, today I'll be introducing NTD intro series Don't Get Bitten Part 2. First, this is today's content and I will introduce venomous snake, the types of venomous snake, and the treatments of snake bite. So, what is venomous snake? Venomous snake is a snake that produces and delivers venom through its fangs. The purpose of venom is not mostly for self-defense, and it is usually for hunting prey. Their venoms are cocktail proteins including enzymes which speed up catalyzed chemical reactions. Here are some examples of venomous snake: copperheads, cottonmouths, coral snake, black mamba, and boomslang. These are also the most dangerous venomous snakes in the world. For the next content, I'll introduce types of their fangs and venoms. There are three types of fangs: Viperidae, Lepidae, and Colubridae. Viperidae have long hollow fangs located in the front of their upper jaw. They can be folded back when not in use. They deliver venom through a strike and release action. Lepidae, they have short, fixed fangs in the front of their upper jaw. They cannot be folded back. They deliver venom through chewing motion. And Colubridae, they have solid, small fangs located towards the back of the mouth. They deliver venom by chewing on their prey. Now, there are four kinds of venoms: hemotoxic, cytotoxic, neurotoxic, and proteolytic. First, I will tell you about hemotoxic venom. Hemotoxins can target red blood cells and blood vessels to cause fatal bleeding. Then, they activate blood clotting. They have enzymes that speedily convert a blood protein, prothrombin, into thrombin. Thrombin helps fibrin to stick together to form clots. Blood clotting can lead to problems such as a stroke or a heart attack. Next, cytotoxins break down the cells and tissues, and they start digesting the prey. So if you are bitten and aren't betrayed right away, you might lose the body part. The picture on the right shows venom-induced cell death, and they have different morphology depending on cell type and venom. The third one is neurotoxins. Neurotoxins attack nerves and the brain. They block neurotransmitters from reaching their appropriate receptors, so they disturb biological processes like central nervous system and peripheral nervous system. Lastly, proteolytic venoms break down nerve tissues. They break down proteins in smaller parts and harm cells, blood, and muscles. Effects are similar with hemotoxic, cytotoxins, and neurotoxins. Now I'll introduce the treatment of snakebite from venomous snakes. This is the first aid for snakebite. If you had a snakebite, you should immediately call 911. It is very important to stay calm while waiting 911 since increasing heart rate can spread venom faster in the body. It is helpful to remove tight clothing and jewelries. And sucking the venom out can cause the venom to spread into the mouth, and it is totally ineffective, so don't do that. The treatment of snakebite is antivenom. Antivenom, or antivenom, is produced using the immune serum from either horses or sheep that have been immunized with snake venom, so it contains antibodies that neutralize the toxic effects of snake venom. The picture on this slide shows the process of making antivenom. Then, how does it work? The venom contains a protein called chlorotoxin which blocks the channels on the cell's surface. After the bite, venom becomes a particular shape, and when it is going to act in our body, the antibodies from forces wrap up the chlorotoxin so that it no longer works and neutralizes the toxins. However, antivenom sometimes triggers an immune response known as serum sickness. It is very rare, but it causes fever, rash, and joint pain after drug administration. It can also cause kidney damage. Doctors treat serum sickness with antihistamines like diphenhydramine and corticosteroids. But most people bitten by a venomous snake survive when they are treated with a sufficient amount of antivenom and an intensive care unit. Lastly, if you don't want to be bitten by a venomous snake, you should pay attention to prevention. The best way to avoid snake bite is avoiding places where snakes may live. Watch your steps and shine a flashlight when walking outside at night, and never handle a snake, or something horrible can happen to you. Thank you for listening. If you have any questions, you are free to comment on this video. Bye.